Hey, everybody. Welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Thanks for being with us today. Our topic today is kids and teeth. Everybody knows that it's so important to make a good first impression, and part of that is having a great smile. And becoming a mom, I know that I really want to establish good dental hygiene habits for my kids while they are still young, so they can carry that into their teen years and into adulthood. Having a 16-year-old in the house, we've already dealt with the whole orthodontic process with, braces and the money that is involved in that as well. We have a great guest lined up to talk with us today about this. Feel free to give this a retweet or share it on Facebook if you think that someone in your life can benefit from this information as well. Our expert today was born and raised in Honolulu, Hawaii. She got her DDS degree from the University of Washington in Seattle, and is one of the few dentists worldwide actually certified in the revolutionary pinhole gum surgery technique. That is a technique that helps people correct gum recession. She joins us live from the greater Los Angeles area in California, Dr. Vanessa West. Dr. West, thanks so much for being with us.
Thanks for having me, Anna.
So many questions about kids and teeth, because at first brush, I think that it's easy to think that this is just, a common sense topic. Like, have your kids brush their teeth twice a day. If you can get them to floss, great. But I think when you actually break down the details of it, people actually have a lot of questions when it comes to their children and how to establish those habits early. We put this question out to folks on Facebook to see what they wanted, as well on Twitter and Instagram from That Expert Show. Let's lead off with a question from Jody from Facebook. She says that her two-year-old may or may not agree to brushing his teeth as often as he should. She wants to know, is this a battle that I need to choose at this age? Also, when he does brush his teeth, he won't let her help him. He's in the I do it myself stage, which means that he mostly just eats toothpaste. She says on the plus side, he does eat his fluoride pill. So let's talk about the 2-year-old and what you do when they just want to do it themselves.
I would suggest allowing them to brush their teeth themselves with the agreement that mom or dad comes in afterwards and brushes it for them. Children lack the manual dexterity to do a good job until they're about 8 years old. So I would definitely allow the child to brush their own teeth and to give them that sense of autonomy and enjoyment in doing it themselves, with the agreement that I would come in afterwards and finish the job.
So that's interesting, because right now with my just 3-year-old, I always insist that I brush first and then she goes. Is there a difference there on who actually does the job first?
Actually, no, but most children who want to do it themselves want to do it first. So either way is fine, as long as the parent is getting in there and making sure everything is cleaned off.
And you said that parents should be helping their kids brush their teeth until they're 8 years old. Are most parents surprised to hear that when they come into your practice?
Yes, most parents are very surprised to hear that. Some children lack the manual dexterity until they're about 9 or 10 even.
Wow. That's amazing.
Yes. It's a recommendation if that's a difficult thing for you to do, to get into your 7 or 8-year-old's mouth. I would recommend using an electric toothbrush, such as the Sonicare toothbrush, having them use that, and that does a much more efficient job than they can do with a manual brush.
And see, I have a question too about, the electric toothbrushes as it is. So when you go to the grocery store, for example, you'll see a million different choices for battery operated toothbrushes that are that come in popular styles, right? There's like the Peppa Pig toothbrush, and they're very appealing to kids. But are those good compared to a manual toothbrush for kids that are like 6 and younger or 8 and younger? Or should you, at a pretty early age, advance to, the higher quality toothbrush like a Sonicare?
I think it would be beneficial to advance to a Sonicare as soon as you can. You can just buy one base and then have various members of your family have their own head. So just buy multiple heads, but just have one base for the child, that's a cost-efficient way to use the Sonicare or a higher grade Oral-B electric toothbrush for a child.
And because
or your
there
children.
is a quality difference, is what I'm gathering
Yes.
from you between obviously that
Yes.
toothbrush and, you know, the $10 electric toothbrush or battery powered
Sure.
toothbrush that you get at the store.
Yes.
Okay.
Yes, but the spin brushes are fine. They're probably more efficient than a manual brush. So I wouldn't discourage you from using that, but a Sonicare or an Oral-B electric brush are better.
So is there the right age to begin with any kind of electric toothbrush or battery powered toothbrush? Is it 2 and above, 3 and above?
I would say 3 and above. Most children, I would say under 5, you may have some resistance to the vibration. You could use it on a sensitive or soft setting to get the child to comply. But most children 5 and under may not like it. But if they're okay with it, I would use it.
Okay. And so Lisa has a question from Facebook as well. She says, is there a trick or a hint to brushing when a child has massive oral aversion?
I would first need to find out what the oral aversion is caused by. Is it something in their mouth, something that is physically hurting them when they brush their teeth? Are they do they have a food aversion? If they do not have any aversions to foods of different textures and tastes, they shouldn't have an aversion to the toothbrush, unless there is something, like I said, physically in their mouth that is making a toothbrush hurt them. I would, if it is something that is, if there's an oral aversion to everything, I would suggest seeing an occupational therapist to help them get over that. If it's just the toothbrush, I would have a dentist take a look in their mouth and make sure there's nothing physically causing that problem. Something that you can do is use a little finger brush or gauze to get in there initially until you work your way up to a toothbrush to brush your teeth. But I would definitely try to get something in there to clean their teeth.
Well, and how early should you really start thinking about a kid's teeth? You know, I think there's been a lot of studies about breast milk and how if that sits on the teeth for a long period of time, it's actually high in sugar, right? And can cause decay for little ones.
Yes. Yes. As soon as teeth appear, you should be cleaning them. It's also a good idea to clean the gums before they even have teeth. So most children start sprouting teeth when they're about 6 months old. So I would get in there with a finger brush or gauze, a wet washcloth, and clean their teeth after each feeding.
Interesting. And then can we talk about pacifiers a little bit? I guess we can like start, you know, with the infant stage and then move up. Pacifiers and thumb sucking. Any advice for parents on these type of things?
I know there's orthodontically approved pacifiers, which are okay. And as far as thumb sucking, by the time they're 2 or 3, you want to curb that habit because it can affect the development of their jaw. It can affect the shape of their palate and also the positioning of their teeth. So definitely by 2 or 3, they shouldn't be sucking their thumbs. Something you can do is put a sock on their hand when they go to bed. And if nothing else works, you can see a dentist or orthodontist and they can make what is called a tongue crib, which is an appliance they put in the palate of the child's mouth, and then it pokes their thumb every time they put their thumb in. It doesn't allow the child to suck their thumb. But that's, we rarely need to do that. Most children stop on their own with some help from their parents.
Yeah, I've never heard of that before. I've also never heard of putting a sock on your kid's hand, but that is a cost-effective and practical way to curb the habit.
Yes.
So then as we move up in age, Maylee on Facebook wants to know what to expect at the first appointment. She has a 2.5-year-old, headed to her first cleaning shortly. Their pediatrician says that they should start doing fluoride treatments when they start seeing the dentist here relatively soon. Can you help her out as she's getting ready for that first appointment with her toddler?
Sure, the first appointment is very easy. We normally recommend it within the first year of a child's life, but definitely 2.5 is a great age to start as well to get the child familiar with the dentist and also for the dentist to be able to consult with you as the parent regarding the child's dental and dietary habits, thumb sucking use of a cup or straw, and cleaning the child's teeth and painting fluoride is all part of the first visit, checking the teeth, making sure they're all there, making sure they don't have any cavities. It's a really enjoyable, easy appointment. I would recommend going in as soon as you can. The younger the child, the better. That way they get more familiar with the dentist and aren't as afraid of them at a young age. Yeah.
You mentioned fluoride, and we have a lot of questions about that as well. Lloyd, for example, has a question about silver nitrate brushed on a cavity and then sealed with fluoride, whether that's an effective way to treat toddler teeth or is that a scam?
I don't think it is a scam. I think it does help those who have a lot of decay in their teeth. It does also stain the teeth. So I think most parents would not want that done just because of the staining, but I believe it is beneficial if you do have a lot of cavities in your teeth to kind of curb the tooth decay. But if your child is not at a high risk for cavities, it's not something I would recommend. Fluoride definitely does help strengthen your teeth. Fluoride's benefit is topical and not internal, so you don't need to be drinking the water to have the benefit. You can rinse with it. I would recommend brushing with a fluoridated toothpaste, about a smear when the child is under 3. When the child is 3 to 5, a rice grain size amount is good to start with until they learn how to swish and spit.
That's interesting because Carolyn, for example, on Facebook wants to know, are kids getting enough fluoride? And I know the debate has been going on for years and years about whether fluoride is actually healthy for you to ingest into your body. You're saying, rinsing is one option. Not every city has fluoridated water, but many do now. Where do you stand on that debate?
Fluoride's benefit is topical. It's not internal. So if you want to stay on the safe side, you can just keep fluoride on your child's teeth topically by drinking filtered water if you're in a fluoridated city, and using the tap water just to swish and spit with. You don't need to ingest it. Using a fluoridated toothpaste, like I said, starting from a young age is fine. Just a smear of toothpaste until the child can spit it out. And if a child is at a high risk of tooth decay, I would recommend a fluoridated mouth rinse a few times a week once they're, I would say, 6 or 7 years old and able to spit it all out. Another treatment your dentist can provide are fluoride varnish treatments, which is a fluoride varnish that sticks onto your teeth and benefits it greatly. And you don't brush it off until about 4 to 6 hours after it's done its job on your teeth, and it can harden your enamel and make your teeth more resistant to tooth decay. So I think fluoride is very beneficial topically.
Okay, interesting. Let's talk about orthodontics, because I know that's a big thing for kids and even more so their parents who have to save up potentially for an expensive series of orthodontic work. When is it time to start thinking about an orthodontist and getting a consult on whether your kid needs braces or some other kind of corrective wear on their teeth?
I would recommend seeing an orthodontist by the age of 7. That way the dentist and the orthodontist can evaluate if the child has any bite issues or malocclusion, if there's any type of interceptive treatment they can do with your child. prior to putting on full braces when they have their permanent teeth at about age 12. So unless your dentist tells you that your child is in the clear and there's no issues, I would seek an orthodontist consult by the age of 7, just to rule out, like I said, any bite issues.
By 7. And when should your child, how often should your child be going to the dentist, actually?
They should be seeing a dentist at least every 6 months for a cleaning, checkup, and fluoride varnish treatment. If fluoride varnish is something you are opposed to and your child is not at a high risk of caries, that's something you can discuss with your dentist.
Okay.
It's optional.
What are the most common questions that parents have for you when they come in? Like, what's the big thing that surprises them the most, other than learning that they should be brushing their kids' teeth until they're 8 years old?
Starting to floss as soon as the baby molars touch is something that's very important, because the toothbrush can't clean in between those teeth. And I would say by the time the child is 4 or 5, most of them do need to be flossing nightly. Another thing that surprises parents is that, yes, baby teeth do need to be filled if they have a cavity, because they're very important space holders in your mouth for your permanent teeth. If you allow the baby tooth to have a cavity and it grows larger and becomes infected, you need to take the tooth out. And then that creates a space dilemma for your permanent teeth, which would necessitate early orthodontic treatment.
I see. So what do you recommend when it comes to flossing then? Because we've tried it kind of on and off, not very consistently with the 5-year-old, and she sort of will do it half-heartedly. Is that another thing that parents should be doing for the kids?
Definitely.
Okay.
Flossing is pretty tough. So I would definitely recommend you going in there, whether it's with a floss pick, one of those flossers where the floss is on a stick, or with the regular floss. And at the dental office, the dentist or hygienist can show your child how to do it and have them do it with a mirror, but definitely the parent should come and follow up. I also have the parent come into the room so that they can see how I'm flossing the child's teeth, and they can do it themselves at home.
So either the strand of dental floss or the little pick things, either of those are just as effective?
Yes, for children's teeth, either is fine, whatever is easiest.
Okay, and so definitely the pick thing is easiest than getting in there with 2 hands and a strand of dental floss.
Exactly, yes.
Besides, they make like kid versions of those, which occasionally have flavorings and other things to try and entice kids to do that. Are you opposed to the different flavors on the floss to try and make it a more fun process somehow for the kids?
No, whatever does the job.
Okay.
It's fine.
Okay.
Yes.
I had another question too then about whether your child's diet actually affects their teeth. My 5-year-old came home recently because her preschool had a visit from a dentist who told them that, what was it? That eating chocolate is better than eating goldfish. Can we talk about this debate? Because now every day she's insisting that she should be eating chocolate because it's better for her teeth than goldfish.
I'm assuming the dentist meant dark chocolate that doesn't have any added sugar.
Oh yeah, that detail might have been left out by her. Yeah.
Things like goldfish that are high in carbohydrates and kind of sticky to your teeth are not good for your teeth, but a child can definitely eat that as long as they rinse afterwards. Does that answer your question? Yeah.
Kind of, yes. So things like goldfish, are there other things that you need to be aware of? Because I know that like gummies are a big thing for children. Gummy vitamins, gummy bears, for example. It's like a regular staple for kids under 6 right now, it seems like.
Yeah, those are definitely not good for your teeth. They're high in sugar and acid and sticky.
Yeah.
So I wouldn't recommend that. They can also possibly pull fillings out. Oh. If they're extremely sticky. things like dots, tootsies are very bad for your teeth.
All things that my children are big fans of. Okay, good to know. Good to know. When it comes to cavities, like how many kids do you have coming in these days that actually have cavities, and how much of that has to do with your family genetic history, like whether you just have soft teeth or the kind of water that you're drinking?
I think about 60% of the children who see me do have at least one cavity. A lot of the times it's from the bacteria in your saliva, which is transmitted from the mother. So if you as a mother have a lot of bacteria in your mouth, and as you're raising your child, you introduce the bacteria to your child's mouth. Children are born with sterile mouths. They get the bacteria from us, from their caregivers. So if the mom has a lot of cavities, and chances are the child will as well. As far as the genetic makeup of their teeth, that can affect their susceptibility to caries as well. But there's also a lot you can do with your diet and your brushing and flossing at home that can help.
How does your diet, in fact, affect your teeth, especially for a kid?
I would recommend having a high calcium diet and a low sugar, low acid diet. I would definitely stay away from soda, and fruit juices I would keep to a minimum. I would opt for yogurt, milk, water. Water is definitely the best thing for your teeth. And stay away from sports drinks that are high in sugar and caffeine and acidic.
Interesting. Okay, so would you do you have a general guideline for the number of sugary snacks that a child should have during the day?
I would limit it to one or two, and getting it all in at one time is the key. Rather than breaking it up throughout the day. So you just have one sugar invasion during the day, one acid attack on your teeth, and then rinse with water afterwards.
Interesting. Okay, that's a good guideline to try and go by. I mean, I feel like it's really hard these days if you're really trying to limit your kids' sugar intake, because especially with every single holiday, whether it's Easter or Valentine's Day or Christmas, like every holiday feels like it's associated with some kind of like sugary snack or candy. Sometimes as a parent, you can feel like you're, fighting a losing battle.
Sure, that is tough. Something you could do is just hold on to the candy and then give it out once a day. Allow them to have, whether it's one or two pieces once a day, is what I try to do with my children. If you don't like the candy that was given, say they were all Tootsies, you could replace it with, say, dark chocolate and give them that instead. Have a little stash of snacks that you would prefer to give your child rather than the candies that were given to them.
Or even like, I guess maybe sugar-free lollipops. Would you recommend those as an option?
Sure. Especially candies with xylitol. I give those out on occasion, are very good for your teeth. Xylitol's a great sugar substitute for your teeth.
Okay. I will be looking that up. Awesome. Speaking of which, we'll probably create, well, not probably, we're going to create a tip sheet based on the information that Dr. West is sharing in this episode, because I know we covered a lot of different areas of this topic. So we'll post that on the website after the interview, so people can share that with friends and family, so they can pass this good information along. Any closing thoughts for our viewers about kids and teeth, and just your best advice for how we can help our kids have a healthy set of teeth?
I think definitely limiting the amount of sugary beverages throughout the day. I know a lot of children sip it, and even adults sip sugary beverages throughout the day. So just taking that away will greatly help your teeth. And rinsing with water after meals. Another tip I would give is to make sure after you brush and floss at night, you don't eat or drink anything afterwards. I would start this when the child is an infant, as far as nursing and feeding your child, make sure you get into the habit of just going in there, like I said, with a finger brush or a washcloth, a gauze, and water, and just wiping their teeth down. If you get into a good habit at a young age, then the child will have less aversion to brushing and cleaning their teeth as they grow up.
I have two more questions. I always say last
Sure.
question, and then I think of more questions to ask.
Sure.
For
Sure.
Teenagers, teeth whitening. Obviously, they do it on their phones when they put the filter on, and they're like fixing the look of their teeth. So I think that kids are probably asking at a younger age now, "Hey, can I get my teeth whitened?" What are your thoughts on that?
I think tooth whitening is safe and fine. The tooth whitener we use also has fluoride, so it does also strengthen the teeth after the whitening is done. Sometimes the whitening can weaken the teeth a little bit and cause some sensitivity. So I wouldn't recommend doing it until the child is at least 16 years old.
At least 16. Okay, you heard
Yes.
it, parents. That's the
And
cutoff.
yes, and keep in mind beverages like coffee, tea, soda can quickly darken the teeth. So if you have that habit, if the child has any of those habits, then it's really not worth it to whiten their teeth.
Yeah, and I think that's totally possible because I think, coffee companies, for example, are marketing at younger and younger kids to try them.
Yes.
To try to
Yes.
get them, hooked on their products. And then one last
Sure.
thing, when you're shopping around for a dentist or an orthodontist, what are some warning signs? What is the best advice that you have for people who are looking around for just the right fit?
I would recommend going in for a consult at any dental office that you're interested in before committing to having an exam by them. I think most dentists are open to meeting you and having a consult, having you take a look around, asking them questions, and I would suggest doing that.
Yeah. Okay. Very good. Well, Dr. West, thank you so much for joining us and for giving us your insight. So much good information covered in this interview.
My pleasure. Thanks for having me, Anna.
All right. And thank you for joining us for this episode of That Expert Show. Oh, again, a lot of topics covered within the general area of kids and teeth. So we will create a tip sheet for you that goes on thatexpertshow.com, our website. We'll put them out on our socials as well. You can always connect with us via Facebook, Twitter, and Instagram. I'm on Facebook at Anna Canzano, Twitter and Instagram at That Expert Show. If you don't have time to catch the show live on Mondays at 11 a.m., you can always watch it after the fact on our YouTube channel, That Expert Show. We also put the content back out to you as a podcast. So wherever it is that you listen to podcasts as you're going about your busy day, Apple iTunes, Google Play, TuneIn, Spotify, Stitcher, all those good places, you can listen to our show that way as well. Drop me a line if you can and give me your thoughts on what you think the next topics should be. But we are here for you every Monday at 11 a.m. Pacific time live, taking your questions, answering your questions, and getting you the best information from the world's best experts. So that is the name of the show, That Expert Show, where you help run the show.